First of all, the topic wasn't supposed to be the kidney and bladder infection. It was supposed to be witch doctor medicine, if you remember.
Yeah.
But came last Sunday morning, my whole PowerPoint disappeared and nobody could find it on the computer. So I had to start over. And I had this half prepared for next month, so I decided I would do it. Next month we're going to do, at the end you'll see, but so I don't forget, the very first thing we're going to talk about is reasons to go to the emergency room. There was a lovely lady at breakfast the other morning who said, you should talk about when we should call the paramedics. And I thought, God, what a good topic, because I myself was down with Phil also with vomiting and diarrhea this past week. And I was trying to decide, gee, should I go to the emergency room or shouldn't I? Because I knew I was dehydrated, but how bad was it? Yeah. Phil, in the back is Patrick, if you would please. So, let's get started. Where your ribs are. Oh, this plant's going to compete with me. Where your ribs are. Now go all the way around. Your kidneys aren't down here, they're up here. And just something, that's, poor Phil one time, he had a kidney stone, and I said, well, let's make sure that it's one, and I went pop to his back, and he said, ah, and he rose up off the floor, but the kidney stone he passed, so. Anyhow, that's where they are, up under the kidney, under the ribs in the back. Now, sitting there on top of the kidneys are the adrenal glands. I don't know why they're there, that doesn't even make good sense, but that's where they are. And coming from the kidneys are ureters, U-R-E-T-E-R, ureters. And then we get to the bladder. And then the urethra is where the urine comes out to the bedpan, the toilet, the diaper, whatever. So, simple view. A kidney, what does it do? Well, it's responsible to purify the blood. It takes the blood from the renal artery, takes it into the kidneys, and from the kidneys, it will be in the kidneys, the blood will be purified of the top of the substances they're responsible for, and through the renal vein, the normal blood levels of those substances will be in your blood, and the urine will come out, down from the ureter to the bladder, and then out. The bowel cleans the body of the solid substances that go through, that we've taken from the small intestine, the nutrients are removed and nutritive substances, and then anything that's in waste product gets excreted through the bowel. When we talk about the blood, we're going to do it through this little system. Here the blood comes into what is called a nephron, and the excess will go out in the urine. This is the simple view, and this is how I look at the kidney. Just think of pouring a bucket of cooked spaghetti into a colander. The colander holds what's good, and it lets out all the starchy water and all the waste products, too much butter that you put in there and everything. All of that comes out through the strainer. So I look upon a nephron that way. The blood comes in, and we've got the strainer. if you lose one kidney, everybody knows about people giving kidneys to other people, so obviously you're not going to give away your kidney and have it be a detriment to you. One kidney lost, absolutely normal life. A third of the other kidney lost, still normal. 2/3 of the other kidney. All of your lab values for renal function will still be normal. As long as that 1/3 of one kidney works, your labs will be normal. Fantastic. We've got that with our lungs, we've got that with our heart, we've got lots of things going for us that we can, how we sometimes damage ourselves. So when you get to the point that you're left with 1/3 of one kidney, the equivalent of that, that's when renal failure begins to occur. Now, when someone gets to that point, they have to have dialysis. There are two types of dialysis. One where you go in through an artery and vein. They put a port in very hard on the blood vessels to do this, but people are known to have lived as long as 20 years with dialysis. That's a long time for when your kidneys fail you. Yes?
I'm sorry. What would cause the kidney to fail?
Oh, we're going to get there. We're going to get there.
Okay.
The other is peritoneal dialysis. This is the belly, and the substance that is thicker than the fluid in the belly is allowed to go into the abdomen, and then it will be allowed to stay for X number of time, whatever the doctor's formula is, whether it's 1 hour or 5 hours, whatever it is, and then the clamp will be opened and that substance will be taken off by gravity from the belly. My sister, who passed away last week, as a matter of fact, she had abdominal dialysis for almost 10 years. So it's amazing what the body will do. And her husband, who was a mathematician, is a mathematician, he figured it out. He was like, I don't know, Einstein. It was this many cc's and had to come out this much. I'm sure that's a lot of reason that she lived as long as she did with it. But it was done during the night for her. So not the business of going to the dialysis center 3 times a week, which is, they even went on a cruise and the substances that the dialyzing fluids were sent to the ship for them. So, I mean, they make it pretty easy. Oh, a pain of a kidney stone. Ow, how many have had them? Oh, come on, somebody else. Philip, you've had one. Hurts like the devil. And the thing is that you start the beginning of the process is, what can be wrong? I hurt. And you begin to think, what's wrong in my belly? And that's exactly what they'll do when they first go ahead and examine you, is one right over that flank spot, and you will know if there's a kidney stone or not. Now, kidney stones coming from the kidney, what happens to them? They don't just mysteriously disappear. Here they are up in the pelvis of the kidney. And they can stay in the pelvis of the kidney for a long time and do nothing. They'll just be there. But if they decide to move, we have a problem. So here, these are just stale, stagnant ones. Here we've got one that's decided to move into the ureter. Well, the diameter of the stone is bigger than the diameter of the ureter. Big problem. Most of them, if you think of an eraser on the end of a pencil, tend to be less than that size. So they're just a couple of millimeters big. And they may be painful, but we call that gravel, passing gravel. And when someone has acute pain where you have confirmed by scan or x-ray that the person has a kidney stone, all the urine is strained from then on so that you can catch this kidney stone. Don't ask me for what. But if you're in the hospital when you pass it, they'll send it to the lab and they'll analyze whether it was alkali or acid in content. It is said, notice I say that skeptically, it is said that if you eat a diet the opposite of what the stone was, if it was an alkaline stone, you should be eating an acid diet. Hasn't proved to be absolute. In bad cases, they will encourage the type of diet opposite to the stone. Here we've got an inch, and here we've got the millimeters, so you can see that they're only generally a few millimeters large or small. And a small one will travel without too much pain. Some people will have a kidney stone that it will take them days to have them move down the ureter, and the only medication that seems to be strong enough to cover it is morphine. Did you have morphine, John? No. They let you suffer?
Yep.
Oh. We have a grandson that's had about 7 or 8 kidney stones. It's just awful. And the pain is awful. And they also, here's just, I don't know why that's there, just more of a little bit smaller one coming down. Here is an x-ray with you've got the actual stones here and here. And it's stuck. It's got lots of fluids, lots and lots of fluids, something for pain or not. It's painful. You think of gravel scraping down this tiny little, the ureter is just tiny. It's not as big as a pencil, half the size of a pencil. Now, you can patch the stone on your own. You can have to go to surgery to have it actually surgically removed, and that's the last thing they want to have to do. And they have done lithotripsy where they go ahead and do sound waves to break up that stone. It's successful to a degree. Our grandson had it for a large stone that was stuck right at the head of the ureter, and it was broken up. So those are the 3 choices. Passing it on our own, have some surgery, or crush it with sound waves. Oh my God. Bladder infections, the bane of women mainly, men occasionally. Men who have ever had a bladder infection, they're not easy to cure, but they're not easy to cure in women. We think they are. Okay, women, here's our bladder, here's the uterus, and notice the little short distance to where the opening of the bladder is. And in men, of course, because of the distance, the contamination of the bladder through that urethra, where we void from, is very, very long versus a woman. So women get the infections much more often. Another thing is women get vaginal infections, which men don't have to be concerned about, and vaginal infections often contaminate and cause a bladder infection. Often when urinalysis with culture and sensitivity is done, the vaginal bacteria will be causing the bladder infection. Now, urine is supposed to be, or is normally, sterile. Just think of that. People who have drunk urine because they have it's sterile. So it's not as awful as we think, but when a bacteria enters into the bladder, we get what's called a cystitis. The inflammation of the bladder is called cystitis. And it's called a lower versus an upper system infection. Urinary tract infection. A lower urinary tract infection. Oh, look at the causes. Diabetes, constipation. You're trying to push out a bowel movement and it ends up contaminating in the area, and then you end up with two problems. If you've had bladder infections in the past, I've had so many that it's very easy to get them again. Not any specific reason, you just get them easier than the next person. Stress. I don't know why stress is included in the list. I've been trying to think of a relationship, but I can't. So they have it on the list. Paralysis. Almost anyone that is paralyzed from the neck down, the ultimate cause of their death will be a urinary tract infection, ending up in the body becoming septic. So urinary tract infections, paralysis is easy to have that occur. What was the name of the man who was the movie star that was horseback riding?
Christopher Reeve.
Christopher Reeves, yes. That's what he ultimately died of, was a urinary tract infection. Not enough fluids. Big problem with us seniors, because the more we drink, the more we have to urinate, the more we have to urinate, the more we have to get off of our couch potato position and get up and go to the bathroom. Or those of us who have problems walking, we have to disturb that particular set to get our walker and go to the bathroom. So it's understandable, but the only thing you're asking for is a bladder infection. Now, residual urine, I'll go in that into a minute. My mother always said not to wear tight underwear. But this is true of women. We wear slacks and we wear tight jogging pants, and the air and circulation does not get through, so we have now got a breeding place for bacteria. It is true. It's not just an old wives' tale. The wrong use of toilet paper. It's so easy for vaginal or rectal contamination of the opening of the bladder. If toilet paper isn't used from the front to the back, almost every good mother's taught her child the proper way to use toilet paper, but it's easy to have occur that either the vaginal or the rectal content can cause an infection. As I said, couch potato. So passive lifestyle, but that really means you don't get up and get a glass of water, you don't have exercise, that they kind of go together. Now, the signs and symptoms. Pressure on the lower abdomen. But all of a sudden you realize that you're going to urinate and it's painful. And some people, the pain will because of, I'm going to show you how the nerves cause you to urinate, but also it'll send a message back up to the brain. So you can have a pain going all the way up your body when you urinate and have a bladder infection. That is not uncommon at all. Frequent urination. If it isn't bad enough that it hurts when you urinate, now you have to go more often than you usually go. So you get to have pain a couple extra times. Urgency. I have wet my pants knowing that I have bladder infection trying to get to the bathroom. You just, all of a sudden, that urge is there and you are going. Incomplete emptying of the bladder is what happens when you've got a bladder infection often. And when residual urine, the urine that gets left in the bladder, sits there, it's just going to grow millions and millions more bacteria. So we reinfect the infected place. And it can cause pelvic pain for women. Blood in the urine. I've had bloody urine, so I know that it's certainly possible. The thing I don't like is in this cloudy or strange smelling urine, I could tell when I am getting a bladder infection by the smell of the urine. I seem to get the same kind, and it has a foul smell. So I don't want to smell that smell ever, but if I do, oh my God, I'm going to get another infection. With a bladder infection, you shouldn't be running a fever. You may have something going on along with the bladder infection, but you usually don't, and if you do, it's 99.2. No appetite, but that goes along with any time you're ill from anything. You don't feel much like eating. Now, I have a dear friend here who the first thing she does when she notices she's got a bladder infection is she's looking for the antibiotic that she used to end her last bladder infection with to get one of those tablets left to start taking. That's not wise. It's because what they want to do is take the urine specimen, and you can do a urine specimen here if you get a sterile urine cup. I always have 2 of them, because then somebody can come and ask me for one. So you've got to have, in order to do it at home. I have testing strips. This tests for white blood cells and for nitrates. The breakdown of bacteria causes nitrates to be in the urine. So this is a little you can order these from good old Amazon. They're really sealed tight. One that's open here. Let's see if there's a strip. Probably not. You just you clean off the whole area, perineal area, and then you urinate, and you can urinate on this little strip, and there's 2 little, looks like little tiny, minute pieces of cotton. But when the urine touches that, given, I think it's 2 minutes of time, it will turn deep purple for white blood cells, and it will turn a pinkish purple for nitrites. So that reinforces the information you've already gotten that you probably have a bladder infection. But I keep it at home because I've had so many bladder infections. But you can usually know from the symptoms alone. Now, when you don't have a bladder infection, 8 glasses of water per day. And I have these great big old glasses. And I like to see myself drink from the whole big thing, and I keep track of how many I've had in a day. The more you drink, the less likely you're going to get a bladder infection. After the bladder infection is over, you have to keep yourself hydrated or you're just going to get another one, because you're a person who's susceptible to bladder infections. Now, residual urine, again, it's the amount of urine left in the bladder after you've urinated. You think, well, my bladder's empty after I've urinated. Well, yes or no. After I had enough bladder infections, my doctor sent me to a urologist. The very first thing they do at the urology is they have you urinate, and they measure how much residual urine with a little sonogram, just like they do with seeing the new baby fetuses. They do your bladder, and they can tell you, if you've got 5 cc, 167 cc's, that's, well, 5 ounces were left in my bladder the last time. Well, no wonder I was having problems. So, it's important to empty the bladder. Now, you think, well, when you go to the bathroom, you've emptied your bladder. Well, maybe and maybe not. But if you just take and put pressure right at the opening of the bladder, you would be amazed what more urine will come out if you're a person that, good morning, if you are holding urine. The reason you need to take urine before you start any antibiotic is that they want to do a culture and sensitivity. And the culture has to be done with the urine before it's had any antibiotics start to, because that begins to change the profile of what's here. So they put a drop of urine or 2 or 3 in a petri dish, and they see what bacteria grow. So now we know what bacteria. But then they will do a sensitivity, which is to take that bacteria that caused your infection and put 6 or 7 different kinds of antibiotics on 7 different drops of urine, of the bacteria rather, and see which will kill off that bacteria. And let's see, I was thinking, Mary Pat Carr, who's in rehab right now for an infection in her knee post-surgery, they had to do, I can't tell you how many cultures and sensitivities before they found the right antibiotic to use for her. And she should be there yet for a while. So, where culture and sensitivity, once you know that, then you're supposed to start the antibiotics. But because you're crabby with pain, the doctor will give you some kind of generic for bladder infections antibiotic and hope that that was the one that was causing your infection. Last time I had a bladder infection, she took the culture and sensitivity, gave me an antibiotic, and it didn't touch the bacteria that was causing the infection. So I just had it come resurge, and I had to start back over again with a different antibiotic. $57 on top of the copay. Pyridium. Oh, didn't I put the pyridium? Little tiny red tablets. They stop the spasmodic pain that you get with a bladder infection. And they're just little red tablets, and all you have to take them for is for 24 hours. Now, if you have a bladder infection and that happens, your urine's going to turn orange. So don't think you're dying. It's just that pyridium causes that. After so long, no different than my doctor did, a urologist needs to be involved because there's something more going on. And I have to have a sonogram or something here because, I don't know, something's not as right as it should be. So, that's it. Now, cranberry juice. But you don't have to take just the juice. You can take cranberry it's concentrated cranberry. I take 2 every day, morning and night. Isn't it nice that I've had Now, if you have a lot of antibiotics, anytime you take antibiotics, Activia has extra probiotics in it. You don't have to go and buy probiotics, but you can just use Activia or any, what is this called?
Yogurt.
Yogurt, thank you. That's got bacterial growing agent in it. So cranberry helps to keep the bacteria from the lining of the bladder. That's my chart. Now, healthy bladder. It's got good tone, good muscle tone. Here's one that's all inflamed. Here's one, overactive bladders. Why am I incontinent? Well, when you get to heaven, you can ask God. But the thing is that incontinence can be helped with some people with the medications they have, antispasmodic. Other people, it doesn't help at all, but it can be tried. This is bladder stone. If a stone is large enough and has stayed in the bladder, it will increase in size. Here's a bladder cancer with growths on it, and here's a polyp that it will cause bleeding and they will end up having to take it off. Now, the most common diagnosis, I worked in the ER, believe me, this is true, is an elderly person comes in, bladder infection, possible sepsis. You don't ever get bladder infection as the diagnosis. Bladder infection, possible sepsis. When you have a bladder infection, you don't have a temperature. 99 at the most, as I said, 99.2. But a kidney infection, pyelonephritis, you're going to have a high temperature, 101, 2, 3, 4. It's very evident that something different than a bladder infection is there. And the fever, when you have chills aren't because you have a high fever. Chills are the body's attempt to keep the fever down. You'll have a horrible shaking chill, and then your temperature will rise. So we're talking about a fever always goes with a renal infection, kidney infection. When we get somebody in the bladder, in the ER with a bladder infection, and they say possible sepsis, how do you tell the difference? Their blood pressure is low. And the sequence is the diet, it's the dehydration, the not drinking enough fluids that is going to cause the sepsis. It's the presence of the bacteria, it's there. But what causes the sepsis is you haven't had enough water. So, when you don't drink water, your circulating volume, 5 quarts of blood in a 5-quart container. All of the arteries, arterioles, all of the capillaries, the veins, hold 5 quarts. If you're missing a quart of water, guess what your blood pressure is? Down. When your blood pressure drops, okay, so we don't have enough water in our circulation, our blood pressure has gotten low, and the body says, well, there's not enough blood coming out of the heart. So the flight-fight syndrome takes over. The sympathetic nervous system speeds the body up and makes the heart go faster, 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 faster. Okay, so now we're dehydrated, the heart has to go faster, the blood pressure's on the low side. And here's the gut. When the sympathetic nervous system gets sped up, the gut becomes stagnant. Everybody with me?
Yep.
What's in your gut? Billions of bacteria. Billions. And when the gut is stagnant, those bacteria are going to reproduce more and more and more. And now it's going to leak through the gut into the whole body, and you become septic. And you die from sepsis. Not every single person, but it's the predominant reason for death is sepsis. So, just think of that. I just didn't drink enough water. Well, that's not what the problem is. The problem is not drinking enough water doesn't keep my heart going enough, so my gut gets stagnant. And what's in my gut? Shit. What's in the shit? Bacteria. And the bacteria multiply just unbelievably. And you end up with sepsis. And when you're 90 years old, 91, 92, 93, or in your 80s, it is absolutely a recipe for disaster. So you don't want to go not drinking your fluids. As we said, you can live without all but 1/3 of a kidney. And we automatically, by the time we're 80, have lost 1/3 of the nephrons. That's just naturally that we've lost them. When you have an infection in the kidney, that the bladder, this is why you got to take care of the bladder infection, is the bacteria in the bladder are going to migrate up the ureters and end up multiplying in the kidneys. So you can end up with pyelonephritis. So you've got two bad situations. Not drinking water can cause it when you've got a bladder infection, and not taking care of the bladder infection can allow the bacteria to migrate up into the kidneys. BUN and creatinine are altered. When the central part of the kidney becomes inflamed, it is unable to do the work of the strainer. It's inflamed. All of the holes that would normally be the strainer are all edematous, they're all swollen. So they can't do the work. So the BUN goes up, the creatinine goes up, and different electrolytes can go up. Eventually there's no urine output. Some people have a thing where they can put out urine, but it's useless. It's not keeping the BUN and creatinine normal. They'll call it high urinary output kidney failure. So you put out urine, but the urine has nothing in it that's of value for the body.
Excuse me, I'm sorry. What does BUN mean?
Urea, it's the amount of urea. Urea is the waste product. That's what U stands for. And the urea is from the breakdown of protein in the body. So if you can't get rid of it, the BUN goes up. The BUN clears because we've got lots of water in our body too. So when you're dehydrated, the BUN is going to go up automatically. Okay, ammonia gets converted by the liver to urea. So BUN represents liver function. Urea, the breakdown of proteins. Then we have uric acid and creatinine. All the breakdown products the non-solid particles that go through the bowel, we now have the rest in the blood that has to go out through the kidneys. Acute renal failure is something that happens and you get cured of. Somebody gets a renal infection because of secondary to a bladder infection, they give them antibiotics and it's over and done with and the kidneys go back and work again. But some people will get kidney failure and it destroys the nephron units. The nephrons themselves are destroyed and they have less than 1/3 of one kidneys. So you've got 1 million in each kidney, so you've got 2 million to start with. So you have to have around less than 600 working, and then your BUN and creatinine go up and stay up. And when the clearing fraction of the renal system diminishes, when it gets to starts like yours and mine to be probably 60, 70, something like that. When it gets down to like 15, notice that's 1/4 of 60. So we're down at less than 1/3 of our nephrons working. They have to put you on dialysis. You can refuse dialysis. Anyone can refuse dialysis. We had someone here who lived here for a couple years and he was tired of dialysis and he chose to go ahead and allow himself to die. I have seen 2 patients do that. They did not want to go on dialysis. And it takes a few days to die, but morphine will augment the possibility of having pain and discomfort from it. Okay, how do you get renal failure other than infection? You can be in shock, where your blood volume is so little from a trauma that the kidneys don't get blood and the nephrons begin to become destroyed because they're not getting oxygen. They're not getting blood, and in the blood is the oxygen. So that destroys it. Post-trauma. You can have a toxic substance destroy the kidneys. Who was the guy in Russia who got the toxic substance? His kidney function was pretty much destroyed. And then you can have it from a bladder that works up to the kidneys. Now, nurse, get on the internet. Go to surgery.com, scroll down and click on the "Are you totally lost?" Not too encouraging if you're in surgery. Okay, next month we're going to take the ER, scrapes and bruises and what to do. I hope you're not here, whoever I said yesterday or the day before, to get the Band-Aid off of your wound. It can't heal if it doesn't have a chance to get to air. So you only wear a Band-Aid for 24 hours. So then, things like that. How do you cure a minor infection? That's my favorite, arnica and all kinds of inflammations, dry eyes, and taking care of your ears. So those will be the topics next month. And all I can say is thank you for coming. I hope any questions, I'm happy to stay and talk privately to anybody or any general questions. Oh, that's scary to know, but yes, Bart.
I'm wondering if you would redo the respiratory infection.
I'm going to do the whole thing. We're going to put everything on the camera this year.
Great.
I'm going to do the whole thing. After we get through the witchcraft medicine, I'm going to go back and do the basic anatomy, physiology of the heart, then testing the heart, whatever else. Then we're going to do heart failure. Then we're going to go to lungs, the GI, the whole thing. We're going to go through the whole thing this year. But right now, I'm going to spend 2 or 3 months just on things that have come up in class. After the class is over, usually. No question? Oh my God. That either is good or bad.
It's good.
Thank you, everyone. Oh, thank you. Oh, and if you don't have a thermometer, get one. Yes, Joan? You don't have one. I'm going to give you this one. Everyone should have a thermometer. I made a house call the other day, and the person didn't have a thermometer. And the other thing you need to have is a blood pressure outfit. You don't have one of those either. What?
How often should you do it?
If you're taking blood pressure medicine, you should do it every day.
If you're not taking blood pressure medicine?
Once a week, as long as your blood pressure's been normal. But if you're sick, you gotta have a blood pressure cuff to be able to measure what's going on.
Thank you, Pat.
Thank you, Pierre.